We're joined from occupied Jerusalem by Ms. Ratiba El-Natsha, a member of the Palestinian National Action Committee. Welcome to Q News. Could you tell us, first of all, what is the current humanitarian situation in Gaza?
Good evening. Good evening for you and for your for who listening to us. Actually, it become more and more impossible to describe the humanitarian situation in Gaza Strip. It's very clear, and the UN reporting that Israel is using starvation as a weapon against the Gazian people. It's like a kind of punishment for everyone and killing people by starvation. Um, we are talking about it's the most hard time of entering the AIDS to Gaza Strip since the beginning of these operation on Gaza Strip. So I think we have not just lack of food and medication, it's more and more because we are entering to the winter season, and it's wet and windy and very cold in Palestine, as you know. So people started to suffer from the hard weather and a lack of tents and shelters in Gaza Strip. So I think that people will suffer a lot in the few days coming because of not just starvation and lack of medication, but also because of the winter, the cold winter and wet winter without tent and shelters.
Tell us more about how the blockade has impacted access to aid in Gaza.
Actually, we can't say that we have access for the aid in Gaza, because even the few access of aids to Gaza, that it's very limited and full of complications. It become more and more complicated to reach to people after it entered Gaza as well, because we have non-stop operation on Gaza Strip. There's no safe places. You can't target like a place in Gaza and say that it's a safe place to target in aid. Although today, for example, one of the medical centers for Doctors Without Borders was targeted as well in Gaza. So it's not just about the exist of these humanitarian aids or medical aids, but even if we want to reach for the people, it's impossible under the fire and continuous attacking on Gaza Strip.
And what effect is the pressure on Gaza's health system having on its ability to provide care?
It's like we are talking about what? It's a very limited access to healthcare in Gaza. You know that they targeted the hospitalities, the hospitals at the beginning of this war, and they continuously targeting the hospitals on Gaza Strip. So we can talk about a medical system in real. It's like a healthcare here and there, some clinics or some hospitals that work in the minimum capacity that they can access to. So I think that one of the aim of this operations on Gaza is to make everyone die in Gaza, if not from direct fire, from illness and sickness, and if not from illness and sickness, from hunger. So I think they destroyed any possibility of having a real care system or health system in Gaza Strip. What we have now, it's the يعني, I can't describe it. It's like very elementary aids that we can give to people. It's really very limited and really very hard even to give them a real health care in Gaza Strip. When we're talking about pregnant women, for example, when we are talking about children, there's no services at all in these fields in Gaza Strip, because the priority is now for the injured people, for the serious illnesses. So they put people in priority, and they can't reach everyone and give everyone what we need as a human from this health system. It's like putting people in categories and in priorities, and it's not humanitarian at all.
What you're describing is a terribly tragic and desperate situation. In your view, how has the international community responded to the situation in Gaza?
Just reporting what is happening, because even any exist for these international teams are really difficult and filled for a lot of obstacles from the Israeli side. So they kept having these reports about the situation in Gaza Strip without any real action. I think till now, the international community didn't put a real pressure on the Israeli side to enter these humanitarian aid to Gaza. And I think they are not trying even to put any pressure to enter more and more medical supplies or any other supplies that can help the situation really in Gaza. What enter is a very few and limited, and according to the limitation that the Israeli side put. So they are under the Israeli order, and not like putting pressure on the Israeli side. And we can't witness and talk about any pressure that it's putting on the Israeli, especially in the last 2 months, because even the number of medical or humanitarian aid at all, it's very limited and going less and less and less by the day. So instead of improving the situation is becoming more and more disaster and unbelievable.
Well, thank you very much for joining us here on Q News. Ratiba al-Natsha, a member of the Palestinian National Action Committee.